Hola, hola. Buenos días, buenas tardes. Hola, hola, ¿qué tal? ¿Cómo estáis? Coque, Erika, ¿qué tal? Alex, veo que os vais conectando. Sí que sí, saludamos. Saludamos todos. Un saludo yo, más que nada. Bueno, ¿qué tal estáis? Hacía ya unos días que no hacíamos ninguna conexión así desde mi canal. Hi, my wife. Hi, Kat. Also following. How's it going, everyone? ¿Cómo estáis? Andrés, ánimo a todos. Espero que estéis bien. Bueno, hoy tenemos, today we have a special conversation, a special guest with Stefan Flores. So I've been, as you guys know, como sabéis, he tenido y voy teniendo conversaciones con gente de diferentes ámbitos. I've been having talks with people from different fields, and today we have Stefan, who is a professor of emergency medicine at Columbia University and an emergency medicine physician in New York City. So he has demonstrated a history of working in the hospital and healthcare industry. He was recently interviewed by CNN to find out his perspective about what was going on inside a hospital that was managing the coronavirus in New York City. So New York is one of the places with the most coronavirus cases worldwide, with more than 313,000 infected and more than 18,000 deaths. So you can imagine how busy people have been in New York and the situation there, like Stephen or Stefan. So that's why we're grateful for him for giving us a few minutes of his time. And now we're going to try to find Stefan, and we're gonna let's see.
Hey, how are you?
Hi, Stefan. How are you?
I'm good. Thanks for having me.
Thanks so much for connecting with me and with us, and having this conversation and giving us a little bit of an idea and a perspective of what you've been through, how things have evolved from beginning to today, and share some knowledge with us and perspective. So because I think it's important for everyone to understand better, and so we appreciate definitely your time and your input. So
Yeah,
how are you? First of all, how you doing?
I'm okay. Thank you for having me. It means a lot. I'm a huge fan. I just want to say,
Thank you.
obviously, a
I
huge fan of
appreciate
the
it.
game and obviously of you. So when you reached out, I was super excited.
Thank you. I'm glad.
Yeah. So I'm okay. I mean, I'm tired, honestly.
Mm,
We're 2 months in now to
yeah.
everything.
Hmm.
So when it first hit, it felt like a movie, and it still feels like a
Right.
movie, a
Right.
post-apocalyptic movie. Um, in March, when it first came, it felt like war. It
Hmm.
was surreal. The number of patients that were obviously coming to our doors, lined up in hallways, who were sick,
Mm,
needing to be intubated, or even dying. It was something that we had never seen before in the
mm,
emergency room. Obviously, as an emergency doctor, we are used to death and dying, and we're used to taking sick patients, but
mm,
obviously never to the levels of what we were seeing when the coronavirus hit and what we're
mm,
still seeing. That
mm.
being said, I want to be positive, and obviously the numbers are getting better. We're
Right.
past peak now, which is good, but we're still not seeing, obviously, the normal non-corona cases that we're seeing or that we should be
Right.
seeing. So
Right.
it's slowly starting to get there, but again, we're still ways away from that. So
Yeah. Yeah. I mean, I can only imagine from your perspective. I come from a family of my mom is a doctor, my dad a registered nurse, and I cannot imagine to be overflown with patients with COVID-19, and I'm assuming at first it was kind of hard to not be able how do you treat these patients, right? How do you give them a chance? And the means are what they are, not having enough, I guess, ventilators, not having enough, means to be able to treat this disease and provide the care that you usually would provide to a patient that you know what the protocol is, and to see that so many patients, so many people are kind of slipping away from your hands, and you feel probably helpless in a way. I bet that it's been extremely hard for you guys emotionally, very draining.
Absolutely. I think you hit it on the nose, Paul. I mean, I think a lot of us usually, we know what we're taking care of, right? We have evidence and we have science to help us. Right. And this, we're kind of operating, out of a black box. We don't know because we've never dealt with it before. Right. So a lot of times, exactly, I felt helpless because so many times people come in and patients come in and we don't have great treatments, unfortunately, at this point in time. So, we're doing all these things on the fly, and we're doing, operating out of limited resources with like what you said. Right. But unfortunately, we're not to the level where we could be. And we've always been kind of we're playing catch up, right? We were reactive, especially here in the United States. Mm-hmm. So at this point in time, like I said, it's still kind of a catch up game. But I think we're slowly starting to learn more, and everyone has been working around the clock. And it's been a unifying and igniting force for not only physicians, but everyone across the world to obviously set aside differences and try to figure out what best to beat the virus. So. No,
I think the fact that you mentioned how hard you guys been working, how this has brought us together in a way, and made us feel extremely connected, right? And obviously the healthcare workers, the first responders have been rightfully so and acknowledged as our heroes, because you guys, as you described it, and I also agree with that statement. It's we're fighting a war, right? And we feel like we're being attacked, bombarded from different angles. We don't know what to do. We're like in reacting survival mode, trying to do the best we can with the resources that we have. Probably with not enough PPE, not enough ventilators. It's like, and people are dying and slipping away. But I think that the story that you're sharing, how has brought all of you together, all of us together, fighting this war together. It's been, I think, remarkable. So I just wanted to thank you again for everything that you guys been doing, what you've been doing personally, and please extend. I'm sure, I hope and I'm sure that a lot of you people that know what you do acknowledge that already, and you get hopefully a lot of reinforcement. But I would like to encourage that even more. So, do you think citizens? One question that I wanted to ask you: do you think citizens in New York are acting responsibly? I think we're seeing how our countries, states are like trying to transition out of the confinement of the social distancing to certain degrees. We've seen like plans, phase 1, phase 2, phase 3, but now it's up to the people to act responsibly. I just saw a video in Spain that is creating quite a controversy of law enforcement really being harsh with people that are not respecting the measures and the mandates of social distancing, because they're opening up the doors for people to get out for certain hours of every day, but people do not always act responsibly and accordingly, respectfully to the pandemic, to this virus that it has proven to be so infectious and so damaging. So what is your feel in New York City?
Yeah, I think it's tough, like you said. So right now here it's spring, the weather's getting nice. So I live right across the street from Central Park. So if I go outside and I go for a run or I exercise, like people are outside. I get that people are probably frustrated, they're anxious, they want to get out. People can only be indoors so long. But we can do that responsibly, right? We can still maintain social distancing. We can still wear our masks when we're outside. We can still do the things that we do to obviously prevent the spread of the virus. So it's still possible. Do I think people are responsible? I think we could still be a little more responsible. You know what I mean? So when I go outside or when I exercise, I try to obviously stay away from other people and do the things that we talked about to practice what I preach. But it's tough. It's a double-edged sword, like you said, and probably like you see it in Spain, you're seeing it here, you're seeing it across the world, that people are starting to, get frustrated, right? But
Yeah.
again, we still need to do those things because unfortunately, we don't have any other treatments at this point in time.
Right.
And I know it sounds like, I sound like a broken record, but honestly, you're saving lives by staying inside and by wearing a mask and by washing your hands and doing social distancing. So people really, 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 really need to understand that. And like you said too, it's a dangerous thing, and we don't know. I can have symptoms and not have a cough and be asymptomatic for a week or 2 weeks, and then go out and not wear a mask and get a lot of people sick.
Yeah.
We need to understand that.
No, totally. I totally agree. I just think I would hate for for another outbreak to come along, for another increase of number of cases. And I think that the best thing that we can do is encourage people to be really aware, responsible during this time. If we want the deconfinement to progress, I think we're going to have to be really responsible and take extra care and extra measures, especially when we're outside. So, because I think there's also kind of a contradiction that people are like acknowledging the healthcare workers and they're cheering for you guys in a lot of places. And again, and I love that. But at the same time, if you're not responsible when you go on the street, you're contradicting yourself. So I would really, really encourage everyone to, it's not so much about the cheering and hitting the pots. It's more important to actually, and you're respecting and appreciating more the healthcare workers and the system by being responsible, by wearing a mask, by practicing social distancing and being careful and take this extremely seriously so we don't have another spike and we can continue to get back to the new normality or as close as to what we knew before as possible. No?
Yeah, you nailed it, 100%. So I think, again, we can't contradict ourselves, and people need to realize that. And don't just do it for yourself. Obviously, do it for everyone else, and obviously your family. And there's so many other people that you need to take into consideration, and people can't be selfish. So yeah.
What do you think? Another question that I think it's interesting. What do you think when obviously it's always easier to go back and, hey, we could have done this better. We could have gone back and done this differently. But, from your perspective, what could have been done better? In a city like New York, in the country, overall in the country, in the US, it seems like things have started a little later, right? The action was not taken as soon or as quickly as it possibly could have. So what is your perspective? What is your opinion on that?
I think you alluded to that very well, in that I think we were reactive and we kind of were playing catch up, like I said before. I wish when we first heard about the outbreak in China, that not only us, but obviously other countries across the world took it seriously. I think a lot of us didn't. So because of that, we didn't enact social distancing. We didn't have plans in place. And because of that, we're playing catch up, right? New York City is a special city in that, we have over 8 million people living on top of each other, riding the oldest public transit system, right? And it's an international hub, just like Barcelona or any other big city, right? So a lot of people come in and out of the city. So it's a perfect storm to have a pandemic or to be a global capital for that, or an epicenter. But I think, like I said, I think prevention is key with anything, with any disease. So if we were ahead of the game, if we had, the PPE and we would kind of had protocols in place from beforehand, I think obviously we would have been able to limit the numbers a lot more. So you see, for example, in San Francisco in this country or in other parts of California, they were more aggressive in starting social distancing sooner, and it shows in their numbers. They didn't have the spike that we had. Again, it's not New York City, but still it's an example of what could happen if we were kind of more proactive and we started doing things sooner as opposed to later.
No, I totally agree. I'm a big believer on prevention, on being safe and sorry, and especially when you're starting to perceive a certain amount of danger. And specifically with cities that are structured like New York, that are so dense, right? That there's so much human contact and interaction, that there's so much transit of people coming in and out. You have to take even harsher measurements. So so it doesn't get to numbers like the ones that we've talked about. Over 300,000 people have tested positive, and that's not even being allowed to test everyone, you know. So that's just a number that it's there, but it's probably a much bigger number. So
Exactly.
so then, just to kind of wrap up my questions, then we go to the user questions.
Yeah.
You know, the lessons learned, you know, like a couple lessons that we can learn as far as going through this pandemic, but to prevent the next one, right? I mean, what does a healthcare system need to be? Does it need to be restructured in some way? How can we be more prepared for a type of an infectious virus like this one?
Yeah, I think kind of like you said, so I think we need a unified response. So I think the healthcare system needs a gross overhaul, at least here in America. And it needs to work in conjunction with the government, I think, to kind of connected there. So yeah, I think it needs a unified, coordinated, perfect. A unified and coordinated response, right? Whether it means having the appropriate equipment, whether it means having the protocols in place, and we need to be working together. So at least here in the States, everything is so kind of fragmented. So for example, even within my hospital, it's very different to a hospital further down in Manhattan, which is different than a hospital in, you know, California or in the middle of America. So I think we need kind of a unified system in place so that way we can obviously be ready for the next pandemic to hit. So obviously being able to test anyone and everyone, because initially when this first came in, we couldn't test everybody. Kind of like you said, the numbers are probably a lot higher, but we don't know that because we can't test everyone that walks through our doors. And that comes down to obviously having the materials and the equipment necessary to do that. So I think that would obviously be important as well. And then obviously, like I said, being prepared for the next pandemic, also looking at how it affects our healthcare system and our healthcare workers is very important too. So it's put a lot of emotional and psychological burden on all of us. So obviously we need to be cognizant of these things because it's only going to exacerbate burnout with all of us.
Well, I agree with everything that you've said. I think starting with the last part, I think the emotional toll that it has taken on the healthcare workers, on the first responders, and everyone that has gone through this pandemic and this crisis in a way that it's been highly stressful. I think we are going to have to address that because the effects of that could linger, you know, and could be causing permanent issues. So we're going to have to provide some type of support for all of the healthcare workers across the board and across the world. And then and also as far as, like, you know, even if you take it a step down, you know, to the families that have been in confinement and have also gone through, you know, people losing their jobs, not being able to provide, and you know, paying rent, paying bills, provide food for their children. All this is creating tremendous amounts of stress as well at home. So, and then to me, one of the biggest points is also the transparency and the coordination and communication between hospitals. We're talking about hospitals in the same city, you know, in the same, yes, down the street, where it should be so much more immediate and transparent and efficient between hospitals to be able to transfer and rely information, you know, and then obviously I think that should be extended throughout the country and throughout the world. You know, a lot of the things come, like, if information was more available and transparent coming out of China, where it started, things could have been prevented in a huge way, right? I think that's so that something has to be created globally so we can prevent and get a hold of any potential outbreak of a, you know, the next threat, biological threat. So I totally agree with everything that you said. I think
you nailed it. Yeah, 100%. Unfortunately, we're not there yet, but hopefully
we're not.
Right, all the people that died and all the people that are sick, hopefully they're not martyrs in this process, and hopefully it will lead to global change. I know I sound, you know, cautiously optimistic, but I
No,
really hope that that will happen and that hopefully
it needs to.
will change,
It needs
because
to.
it's obviously highlighting the inefficiencies of the healthcare system
Great.
in this country and probably other
Yeah,
parts of the world, and it's
totally.
showing that the disparities that we already know of and that I know of, obviously being an emergency doctor, but
Right.
it's obviously way worse now that this pandemic has hit. So
Absolutely. Absolutely. Well, let's go to a couple questions from our users. Um, Chris Bernuca has asked, when some form of medicine to block or immunize will be available. When some form of medicine
yeah,
basically
that's a great
will
question. So unfortunately, I mean, there's studies going out literally at light speed every day. I can tell you, people are working tirelessly around the clock.
yeah.
Unfortunately, there's no great evidence at this point in time to
Right.
show us of something, an immunizing medicine or something that could essentially stop the virus. Right now, the thing that we have probably that has some promise, it's this drug called Redesivir that they're saying may have some benefit in stopping the virus and obviously limiting symptoms and the duration of symptoms. But
Right.
again, it's not ready for prime time yet. We don't have it available in every hospital, and it's not out there, like I said, to the general public.
Right.
So that's currently where we're at. We're working on many other things. They're talking about using plasma or convalescent plasma antibodies from patients who obviously recovered from the disease. So there's a lot out there. I think until we get a vaccine, unfortunately, we're still going to kind of be in this black box, but hopefully within the coming months and even more so, we'll have more treatments available.
Yeah.
So.
Well, let's hope so. We all are hoping that would be the case, because we all feel that a vaccine will be like the ultimate kind of reassurance for all of us to feel safe and to resume a regular, normal life, I would say,
Right.
whatever that looks like. And I think that this will, regardless, have some permanent effects as far as being more, I guess, distrustful or careful, even not distrustful, but careful as far as, like certain places and the level of hygiene and just using more, Purell or washing more your hands or practicing more social distancing. And so it'll be interesting to see. Okay. Marcus K, is it safe to move forward with scheduled surgery in New York City? Is it safe
Yeah, so that's a good question. We're starting to, like I said, open things up, at least from the medical standpoint, in phases as well. So initially, we obviously closed down all elective surgeries and all things that were non-urgent. But we're starting to open things up slowly, at least at my hospital and probably at other hospitals. So I would anticipate that it's going to continue to happen. But again, this has to be in a smart and coordinated approach. It can't just be willy-nilly.
Right.
We need to obviously limit the number, and it's not going to be going from 0 to 100. It's probably going to be in slow, gradual phases.
Yeah, that makes total sense. So, and I know there's a lot of patients, a lot of people that are in need of certain surgeries, and that were scheduled and probably have been postponed or canceled. So those people need medical attention as well. So, okay, so Carmen Lopez say, in Spain, the coronavirus lockdown has affected children. There were 6 weeks in lockdown at home. How is the U.S. managing the kid situation, for instance, in New York, right, where a lot of people live in apartments and high rises? That's obviously the kids is one of the collectives are more vulnerable, even though they're very adaptive and flexible. But they have their needs and they have their energy, and they're not going to school and they're stuck at home. So how do you see that?
Yeah, I don't have kids, but I've talked to obviously my colleagues and seeing everyone who does have kids. And my mom's a school teacher herself, so I know schools have been closed at least for the rest of the year. And that's tough because people have been having to homeschool their kids and obviously managing them for all those hours where normally they would usually be at school. And like I said, there's a lot of psychological and secondary effects that are going to come out of quarantining and social distancing. One of those, as you mentioned, would be kids, right? So they can't, their childhood's probably obviously changing, and it's almost being robbed from them during this time. They can't go outside, they can't play, they can't interact with other kids. And that's so important for so many of these children, right? Just for like normal growth and development, and just to have a normal childhood like you probably had. So Hopefully, you know, it'll get better, but I think parents have had to be creative and honestly do a lot of things virtually or from home.
Agreed.
So, yeah.
Yeah, that's what I try to encourage for families and parents to be creative at home, to create healthy routines, healthy, you know, habits at home during this time, to be really proactive about it, and because otherwise, you know, it can, if you can just live it up to, or be upset or be frustrated, and if you don't do anything, it really creates a bad scenario for those kids and for your family overall. So. So yeah, that's important. And I think last but not least, Rocío Lizarraga from Peru said, if the virus can have, it's proven so far that it has an effect on your respiratory organs, also on cardiovascular vessels and organs. But also, she wanted to ask you if there's any proof that it has affected, or you've seen any effects on the reproductive system. That's what she would like to know.
Yeah, it's a great question.
Is there any evidence?
So there's been limited studies, obviously, thus far, looking at how it affects the reproductive organs. They've looked at it with women, and I think I've had one case of vertical transmission, so meaning from the mother to the baby. And if you're breastfeeding, you can still breastfeed. They're not seeing any transmission through breast milk. But as far as, I guess, through the reproductive organs, specifically, I guess if they want to talk about sexually transmission, no, there is none at this point in time that we know of. So that's good. Obviously, it's transmitted through the usual way. So through coughing, through respiratory droplets. The other big thing being fomites. So on any kind of surfaces, it can last even for days. So that's why washing our hands and cleaning materials and surfaces down is so important. But as far as, like you said, the effect on reproductive organs, we have limited evidence. But as of what we know right now, not much that really shows that it could be transferred or at least stay and harness within the reproductive organs at this point in time. So knock on wood, okay.
Yeah, hopefully. Well, thank you so much, Stefan, for your time. I don't want to keep you longer than you need to be, and we appreciate so much. You've been so gracious with your time. Thanks for everything that you're doing, and all your colleagues. You know, please send us our strength and our appreciation, because you guys have been incredible, and this is long from being over, so as you probably know, so just keep at it. You guys are amazing.
Thank you so much, Paul, and seriously, it means a lot to honestly invite me on. And again, we thank you too. And again, it's teamwork makes the dream work, right? So
always.
Everyone is involved, and everyone has a role here. So it's not only obviously us as healthcare workers, but everyone on the front lines, and even for those of us staying at home. Everyone has a role to play, so absolutely. I appreciate it, and thank you to everyone too, and hopefully, you know, next time this happens, that we're in a better place. So.
Absolutely. So thank you again, and we'll, as you said, we encourage everyone at home to please do your part. You know, it's not just. You will be thanking and appreciating all the healthcare workers by doing your part, by practicing social distancing, by being safe, by wearing a mask if you can, please, when you're outside. So we continue to manage this virus and support our healthcare workers and our healthcare system. So thank you so much again, Stefan. You've been great. Keep it up, man. All right. Stay strong.
Thank you.
Stay safe, okay?
Take care, Paul.
All
All right.
See you soon.
Later. Bye.
Bye. Okay, so how great it is to have a conversation with an emergency doctor that has been helping out hundreds and hundreds of patients in New York City, where we have the most cases in the country here in the U.S. So we just want to say thank you again to Stefan and all his colleagues that have been working tirelessly around the clock to help patients. So before we finish, first, thanks everyone for connecting. I appreciate you. I hope that these conversations are helpful to you and you learn some stuff and are also kind of energizing and inspiring to you, and you gain some knowledge. Please continue to be safe at home. Continue to be safe if you go out. Please try to wear a mask, try to wear gloves, wash your hands, continue practicing social distancing. I think we still have ways to go on this pandemic. So be as safe as you possibly can. Okay, take good care of yourself, take good care of your family and your friends and your loved ones. And remember that these talks will be available on my YouTube channel, also on Spotify and eBox are also available there, okay? Bueno, gracias a todos. Espero que hayáis podido seguir esta conversación y que os haya también servido esta charla y todo lo que hemos comentado con Stefan. Agradecerle y agradecer a todos los trabajadores sanitarios que estáis haciendo un trabajo enorme para el bienestar de la sociedad, de nosotros, y si queréis apoyar a todos los sanitarios, por favor, seguir yendo con cuidado, seguir siguiendo las líneas de precaución, seguir siendo responsables cuando salgáis de casa para que podamos seguir progresando hacia una nueva normalidad o lo más cercano a la normalidad que conocíamos antes. Okay? Bueno, cuidados mucho. Muchas gracias. Thank you very much. Thanks, guys. We'll talk very soon. I'll be back, I think, in a couple days. All right? See you guys. Bye. Be safe.